there is a false debate about COVID versus the economy. Progress against the coronavirus is progress on the economy. If you don't have progress on the coronavirus, you don't have progress on the economy. Those are two sides of the same coin. So if everybody wears a mask, if everyone social distances, if everyone washes their hands, if everyone is cautious in the environments that they're in, the economy can be stronger. And then, of course, we are going to get therapeutics and we are going to get some vaccines, but they're down the road. In the meantime, the less that we do those things, the more that we open up carelessly, and then the virus can pick up, then the economy is going to be weaker. So health and the economy, two sides of the same coin.
Given the fact that this may be off a while, but employers still need to retain skill and experience that they do have, and it's always, at least the last I knew, is cheaper to keep your skills and experience rather than to replace it. It costs money to replace people, and it costs money to train young people. You had a lot of recommendations for flexibility in providing public and private benefits to enable people to work longer and prepare financially for retirement, because that's not going to go away as an important issue, not only for individuals, but for our society. I mean, if people can't afford to save for a retirement, then that's going to be a burden on society. So you've talked about in your book about phased retirement, flexibility in hours, flexibility with regard to healthcare plans, and so forth for a more mobile benefits. Do you want to comment on that a little bit?
Sure. So, I mean, I think that when you look at all the surveys, the human resource surveys, I think one of the key results is this desire for flexibility, and it cuts across different age groups for different reasons. And one of the positive things that comes out of this, and the numbers are always squishy. They're not very good numbers, but looking at as good as numbers as you have, if you're looking at large corporations, about 70% of the workforce of large corporations could have worked remotely, but only about 3 to 7% were. And so the only ones that were the ones that were traveling, that was part of their job that they had to do. And the main reason came down to partially power. You weren't working if you weren't visible, partially on a more positive, collaborative, get people in the same building, have them exchange ideas. I think one of the positive changes is people working remotely are incredibly productive. And you don't have to have them in the building for them to be productive. So I think that is a positive change on the flexibility side. And I think management is absorbing that. And then the collaboration side is a much bigger challenge, and that's a lot harder to figure out how to do. But this demand for flexibility, it's there, and it's going to increase. And really, a lot of the questions are public policy questions. So if you want a more flexible economy and society, you need to have universal health insurance. It's just, how you design that, you can, we could debate that. But you need to be able to, if you lose your job, you shouldn't lose health insurance, and your family shouldn't lose health insurance.